Hi, my name is Shayna White, and this is my teaching presentation. So we'll start out with the VARC results. When I did the assessment, it seems like based on that, my learning style is pretty mixed, which I wasn't very surprised about because depending on what material I'm learning, I do like to utilize a lot of different learning styles. In some instances, I like reading, writing, taking notes, and other times I like being a little bit more hands-on. It just depends on what I'm learning. So the fact that I was a little bit spread out kind of on a lot of these really wasn't surprising to me, but it did seem like I was leaning more towards the reading, writing, and the hands-on stuff. Based on this assessment, I did decide to kind of gear my presentation, my teaching project, towards utilizing many different types of teaching methods in order to hopefully reach as many students as possible, because I know that not everybody necessarily learns in the same way. Some people prefer to take notes and some people like to do group work. So because of that, I did decide to do a little bit of a mixture. And I'm going to be doing a part of it is a formal lecture with a PowerPoint presentation, and then the other part of it is a group activity. We'll be doing a case study. And then hopefully all of that will be able to reach as many students as possible. But this is the beginning of my formal lecture part. So welcome students, this is week 2. Last week was orientation. We went through the syllabus, we did a little bit of how this class is going to work. So because of that, I do hope that everyone remembered that they were supposed to do the assigned readings, chapters 1 through 4, before coming to class today. This lecture is just going to supplement what you've hopefully already gone over in your textbook. And by the end of this, between the reading materials, the lecture, and the activity that we're going to do at the end, our objectives are that you should be able to identify the major illnesses affecting critical care patients, describe the appropriate nursing diagnoses and assessments of the critically ill patient, and communicate and collaborate with a healthcare team regarding the care and management of the critically ill patient. So we'll review over 2 of the major illnesses that I think people see the most in critical care, the first one being sepsis. So sepsis is a life-threatening organ dysfunction caused by a dysregulated host response to infection. There are early signs and late signs. With sepsis, you want to catch this as early as possible. When you start getting to these late signs and symptoms, that means that we're starting to get into increased mortality rates for these patients. It's very hard for them to bounce back once they've gone into the late signs and symptoms of sepsis. So early identification is crucial in this patient population. So for our early signs, we're going to see an increase in heart rate, a fever, and then you're going to have usually a normal, maybe slightly lower blood pressure. When we get to the late signs, you're going to see an increased heart rate with a low blood pressure because the body is trying to compensate. And then you're going to, instead of a fever, a lot of times you will see hypothermia start to happen, and then a decreased level of consciousness. Nursing management for this would include making sure that you're establishing an IV access. 2 large bore 18 gauge IV sites are appropriate for this patient because one of the biggest things that these patients need is fluids, especially because their blood pressure has dropped. But these patients are severely dehydrated because of the pathophysiology that I'm hoping that you had gone over in your book already. Because of the way that sepsis kind of takes over in the body, it causes severe dehydration, and the best way to save these patients' lives is to start bolusing fluids as quickly as possible. So you need 2 large bore IVs. Get fluids on board. You can do temperature regulation, so if they have fever, you can give Tylenol. If they're cool, you can put on a bear hugger. And then making sure that antibiotics and blood cultures are on board because this is a severe systemic infection. So they need these broad spectrum antibiotics as soon as possible. An appropriate nursing diagnosis for this would be altered tissue perfusion related to the widespread vasodilation. So once again, going back to the patho of it, when the infection takes hold, it starts causing capillary leaking. And so your intravascular space is extremely depleted. It drops your blood pressure. When your blood pressure drops, it causes the organs to start failing. And that's whenever you start getting into high mortality rates for these patients. So the widespread vasodilation is what is causing the drop in blood pressure, ultimately leading to organ failure. The second illness we're going to look at is ARDS, acute respiratory distress syndrome. So ARDS is a life-threatening impairment of pulmonary gas exchange, resulting in hypoxemia, hypercapnia, and respiratory acidosis, requiring acute rescue measures. So these patients are ones that will typically present to the hospital with something like pneumonia for a week or two, just feeling kind of lethargic. And then they start requiring more and more oxygen very rapidly. These patients will come in on 2 liters nasal cannula and end up intubated within hours. So the progressive dyspnea, tachypnea, and tachycardia, big signs of it. Increased oxygen demand, one of the biggest ones that if you're seeing a patient that is going quickly through oxygen supplementation, going from a nasal cannula to a veni mass, a non-rebreather, then we need to start looking towards something like ARDS. Crackles on auscultation because of the fluid and the infection in the lungs. And then the biggest way to diagnose it is through a chest x-ray. So as a nurse, make sure that if you are suspecting this, you are contacting the physician, telling them that you're worried about ARDS, and make sure that you get a chest x-ray, because this right here is what diagnoses the ARDS. These are clear, healthy lungs right here. The completely whited out lungs, that's what we see in ARDS. So for nursing management, you're also going to want to get a blood gas. We need to see how oxygen depleted they are to see if they are going to require intubation. Blood cultures and antibiotics, of course, because of the infection, whatever oxygen requirements that they're needing at the time. And then another consideration is prone positioning. So this is not something that the nurse can order and just implement on their own, but a physician can order a patient to go into prone positioning. These patients are typically intubated, sedated, sometimes paralyzed, and it is essentially a last-ditch effort to try to increase the oxygen within the body, because the way that ARDS works, once again going back to the patho that you've read over in your book, is that all the fluid and the infection and everything have essentially crushed down the alveoli in the lungs to be able to do the oxygen exchange when the patient is breathing in, getting it into their blood system. They're breathing the air in, but the oxygen exchange isn't happening as well because the alveoli are essentially flattened. So when you prone them and flip them the other way, it's opening up the lungs just a little bit in a different way to hopefully increase the oxygenation. The reason why this is a big nursing management thing is because you really need to pay attention to range of motion and tissue issues with these patients when they're in this special positioning, making sure that you're rotating the neck, you're watching the ventilator tube. All the different positioning stuff is nursing care. So that is something to consider when you have a patient with ARDS, because they might end up in that position. And then an appropriate diagnosis for this is impaired gas exchange related to the alveolar capillary membrane changes. So as you heard me talk in the last couple illnesses we were discussing, one of the biggest things that I kind of said over and over again was making sure that you relay this to the physician, that you tell the physician that you watch out for this. Because in every area of nursing, but especially in critical care, the identifying illnesses quickly and being able to communicate them effectively to the physician is one of the biggest things that you can do to save lives. If you call a physician in a panic and just tell them the patient's having a hard time breathing, well, there's a lot of things that can cause that. There's a lot of things that they can order, but if you specify that you're suspecting that it's ARDS and these are the symptoms and everything, then they can get the care that they need a lot quicker. So because I think communication is so important in critical care, and this is critical care nursing, I wanted to go over a tool that a lot of us use in the hospital setting, which is SBAR. It stands for Situation, Background, Assessment, and Recommendation. It's a tool that you use to be able to relay information to the physician. The situation, what is happening right now, what are their issues that they're having. Background can include patient history, why they came to the hospital, signs and symptoms. The assessment is what problem you think the patient is having right now, and the recommendation is what you think needs to happen. Labs that need to be ordered, medications need to be changed, etc. So as an example, this is a patient that we're concerned is having a heart attack. So I'm going to go over how I would call a physician using SBAR with something like this. So, hi, Dr. Jones, this is Jane Smith. I'm calling from the ICU. I'm taking care of Todd Michaels in room 204. He's a 62-year-old male, currently complaining of crushing chest pain and appears diaphoretic and pale. He has a history of CAD with stent placement. He presented this admission with intermittent chest pain but no ST elevation on his previous EKGs. He has been taking Coumadin at home and is scheduled for a cardiac cath tomorrow. Current BP is 168/92, heart rate of 65. I believe he might be having an MI, and I'd like to get a stat EKG and labs and need you to come to the bedside to evaluate him right away. So let's break this down just a little bit. In this situation, you're saying who you are, you're identifying yourself, where you're calling from, the patient, and any symptoms that they're having, what you're kind of concerned about right now. The background, you can include any patient history that you think pertains to what issue they're having at the moment. So this guy is possibly having an MI, so I included that he does have a history of coronary artery disease and has had stent placement before. Then you're talking about why he came to the hospital. You included the vital signs, which are incredibly important no matter what you're calling for. You usually want to include those. And then I also included that he's taking Coumadin because something like blood thinners, especially Coumadin, is something that the physician is going to have to consider whenever they're ordering certain interventions, labs, tests, etc. It's a medication that has a lot of considerations and implications for things that they might want to do with this patient. And then I said what I thought was happening with the patient, and I gave my recommendation. Said I needed him to the bedside right away, and I'd really like to get this stuff right now. So the physician might not always take your recommendation, but it is always good to give one so it kind of gets everybody on the same page for what you're thinking and what they might be thinking as well. So based on this SBAR template, we are actually going to do a case study and group activity. Everyone's going to break up into groups of 4. Everyone's going to get each group is going to get a different case study, and I want you to answer the questions that are on there, and then utilizing the template, I want you to practice with one another, pretending to be a nurse and a physician calling each other about this patient utilizing SBAR. So then at this point, it would end the formal lecture, and if I had students here with me, I would be doing this case study. And the idea that I had for this was that, like I said, they'd be in groups of 4, and it would be very hands-on. I would walk around the classroom while they are working their way through the case study, while they're talking with each other and practicing amongst each other. I included the case study that I had created. This is my original questions template, everything that I had done. For what I would have given the students. It asks them to list the nursing interventions, the SBAR component, what they think the patient is suffering from, and then nursing diagnoses that are appropriate for the patient's issues. And then at the end of the group activity, with everyone kind of being hands-on about it, I would go over all the case studies with everybody together, and then maybe even bring a couple patients or a couple students up to be able to practice doing that in front of the class if they feel comfortable to do so as well. And then hopefully between the formal lecture and then this hands-on activity, I've reached as many students as possible to be effective with what I wanted to get across in this lecture. And that concludes my project. Thank you.